if anybody has any question, to go have a developmental screening done, and that even at 2 months, somebody can find out if a child does need help. And to help parents understand that it's not a negative thing, and if you get that child help sooner than later, then you're not going to have any regrets.
The American Academy of Pediatrics has recently revised a policy statement wherein they say that every child should receive a standardized screen at least 3 times before the child turns 3 years old. So this should be comparable to having your child's height and weight checked at a well-child visit. It's something that as a parent you should just expect when you take your child to the doctor.
The developmental screening test is actually a very simple thing, and we do find a proportion of kids, it can be 15 to 20%, that are falling a little outside of what we find the typical development for their age. So what we then do is either get them back sooner to check it again, we talk with the parent at a little deeper level about that specific topic, or we refer. And there are some parents that'll be afraid of a referral. They're afraid of a label for their child is not developmentally appropriate, or they're afraid of maybe just what it means. They may be in some denial. But really, all we're doing is a screening test. Just because a child's referred doesn't mean they have any kind of problem. But if they're referred, it's very much worth the parent's effort to have the evaluation done.
When I talk to families about the importance of early intervention services, I like to think of it in terms of helping infants and toddlers and children achieve their full developmental potential. I don't like to talk about it in terms of catching up, because I don't know to whom the children are catching up.
And some children just need a little extra boost. They don't need a whole lot. They need a couple of evaluations or some following over a year and they're done. Some children need that much more, but for all of them, the sooner we get started, hopefully the sooner we get done. And it has an impact in many different ways at many different levels. The children will do better in life, better in school, better with jobs and relationships.